We've suffered through 2 major hurricanes and 2 major floods in the past 5 years. And if we did not have the CON laws that help protect rural hospitals, I shudder to think what would have happened to the community and the patients if there had not been this resource here in the community to help with the medical needs of those most impacted by the hurricanes and the floods. We're the only group that were able to continue to operate our home health to make sure that we got oxygen out to homes. We suffered massive power outages and water outages here in Lumberton during those hurricanes, and most operators couldn't and wouldn't operate under those conditions. And I hate to think about people not getting their oxygen at a time when you have a major catastrophic event, or not getting health care, or ambulances not running. It would be very catastrophic. So in a repeal of CON, you would have to look at services that you potentially close down. Inpatient psychiatric medicine is one that certainly comes to the top of mind. And again, there's already too few psychiatric beds in the state of North Carolina. To lose 1 bed would be very significant. Other services might be other inpatient beds. You may just have to close down some inpatient beds here in rural North Carolina. And any closure of other inpatient beds only pushes more and more into the metro areas. And that's a real struggle for families. Not everybody has reliable transportation and has ways to get into larger cities. Many don't want to, or just for whatever reason, uncomfortable going to larger cities, to larger hospitals. And so what they inevitably do is delay care or don't seek care because they don't want to have the chance they might be referred to a Raleigh, a Durham, or Charlotte, because it's just too far for them. Many of these services that we do offer in rural hospitals are so important. Things like we have here a behavioral health unit, 26 beds. It might threaten our ability to continue to provide that inpatient behavioral health medicine if we didn't have the CON law. In an area already suffering with mental health and mental illness, to remove resources would be detrimental, if not catastrophic, to the community. And I would encourage any of them to come understand what these services are that are supported by these CON laws.